Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Welcome back to Between Two White Coats, and today we have a very special friend with us, Holly. Holly is our physical therapist here at Our Family Health, and we are excited to talk about why we have physical therapy here and why we find Holly to be such an important member of our medical team. But first, before we dive into the physical therapy stuff, tell us a little bit about yourself.
Okay, well, I'm Holly Atkinson. I'm a physical therapist. I've been a physical therapist for 25 almost 25 years.
It scares us when we start
I was
thinking of how much
super young. I
experience
was like Doogie Howser. Yeah. So most of my practice was in geriatrics. Then I took a little hiatus from that, and I worked at a private school, and I taught girls weight training, health, anatomy, a couple other classes, and then I landed here.
Talk to us a little bit about physical therapy in the geriatric population, physical therapy in young students, and how all of this matters at all these different stages of life.
So we'll talk about students first, I guess. I saw, especially being a female, female athletes are at risk for injury because usually as they go through middle school, they're taller, longer, their bones are heavier, but their muscles are weaker because girls don't have the testosterone that boys have, so their muscles are weaker. They're more at risk for injury. So that was my focus there, teaching girls weight training, was to keep these athletes strong and healthy and prevent injury. So just being a physical therapist, I studied muscles and kinesiology and physics for about 7 years. And really, God just gave me a mind where that just makes sense to me. Like all of that was just easy. The human body, the amazing machine that it is, just makes sense to me. And so I think that's been a gift. And so when I can look, most of the time, look at movements that you're doing for your sports or that you want to be able to do for your sports, and with understanding of what muscles are needed, if it's endurance or power, say, okay, we can do these few things and we'll probably help you get to where, or closer to where you want to go.
Which you were an athlete, correct?
Yes.
I would say. So is that what drove you to physical therapy?
I think being a cheerleader is what drove me that way, because it's really, I wanted to be a doctor, but I didn't want to go to school that long. I am naturally a cheerleader, and so it kind of puts both together, where I get to help people get well, and I get to cheer them along the way. And as a little bit of a counselor, a little bit of like, come on, you can do this. I know you don't feel like it. It's good for you. Like, this is going to pay off in the long run. But that cheering people along the way is just in me. Yeah. And I love getting to see people get well. Like, that was amazing. So then going to my geriatric experience, most of my experience was in subacute rehab. So people would come to the rehab center after a stroke, hip replacement, broken hip, knee replacement, weeks in the hospital from pneumonia or whatever, and they were not well enough to go home because they were not strong enough or independent enough. So we would work with them weeks, sometimes months, and the goal was to get them home. And that was the most rewarding. Like, I just have memories burned in my brain of patients walking out the front door. Yeah. That was so rewarding. And so, seeing that with older patients, and then also with student athletes, seeing them achieve goals. When I worked in the school, and they, we'd work and they'd come back in and say, I can steal bases faster. I've got this many more stolen bases this year because I'm faster, or I've got this many more home runs because I'm stronger. That was really rewarding to see them achieve goals that they wanted.
And I think it's interesting if you think of us as a primary care office and a wellness center. Why do we have a physical therapist on staff? It's probably not the most obvious thing. We definitely say that one of our 4 principles for healthy living is movement and exercise. And collectively, I probably got 4 weeks on the musculoskeletal system. However, when that system doesn't work, you are no longer independent. When you are a young athlete and your whole identity is in your sport, and you have a career-ending injury that could have been prevented, these are major impactful things. And so we decided as we were building our wellness center that one of the more important parts of our team would be a physical therapist, because if movement is one of the 4 things we're focused on, then let's have someone who has so much more training. What is the training required to become a physical therapist?
So I did have to get an undergrad degree first, and then in the state of Georgia, when I graduated, it was a master's degree. Shortly after, it changed to a doctorate degree, which the difference is it added some pharmacology and some
Probably paper writing.
writing. Yeah, it added about another semester of school where you had a little bit more pharmacology, and then like reading CT scans and MRIs and things like that, which is a little bit out of our scope of practice anyway, but you're trained on how to do it so that if it's in a chart or whatever, you can.
And you're working closely with orthopedic group, you'll understand what they're talking about and all those kind of things.
So we had to understand all of those lab reports, but they got a little bit more on actually reading the scan. So,
and I think what we do in physical therapy in this country is what we do in healthcare in this country. After it is broke, then we turn you over to the people who are well trained to fix it. And what we want to do is take a different approach as to what if we could just not break it to begin with? What if we could really optimize your body at whatever age, from the student athletes up through our geriatric population, so that you don't end up with injuries that you may or may not come back from. And so what we're doing in our physical therapy setting is a little bit different, maybe a lot different than a traditional healthcare insurance-based physical therapy setting. In typical physical therapy, and if any of you have had physical therapy, you could tell me why you had physical therapy. You had an injury, you had a surgery, you weren't recovering from a fall, and you got into physical therapy. And when you went to physical therapy, there was the come 3 times a week, and sometimes that adds up when you're paying a copay each time, even though it is insurance covered to some extent. And be pushed and cheered. And I will say to everyone who thinks, I'll just do this at home when they're in a medical situation, you will not do as well at home as you will when the physical therapist is pushing and cheering you along. But it requires a diagnosis. In order to do this and bill insurance for it, we have to say what's broken, what's wrong. So it is that there was an ACL repair, or that there is some kind of fall disorder, neurologic condition. There has to be some kind of diagnosis before insurance is interested in paying for any of it. So what if we try to get to you before the diagnosis, or what if we try to offer things different to help you along? And that's really what we're more interested in doing here. So talk to us, Holly, about Holly and I sat years ago now and built some very unique, different, we leaned into a lot of her knowledge and built some unique ways to evaluate people, because what we're trying to do from a medical setting is say, what objective data can we have to where you start? And then we give you a plan, and then we can revisit that objective data to see, are you progressing? Is the plan meeting the goals? This is what we do all day. You're a diabetic. We get an A1C. We see what your sugar is. We make changes. We get an A1C again. And so we were building that around trying to optimize people's musculoskeletal systems. So what are some of the things that we do here that are different than places that you've worked in the past?
So we developed the 4S assessment, so that 4 S's stand for strength, stability, stamina, and stretch. So it's a fairly quick assessment because nobody wants to come in and be put through a battery of tests. So it is just an assessment. So first I look at your strength, pretty much full body strength, looking for muscle imbalances mainly. Muscle imbalances are going to put you at risk for injury later on, or just discomfort. You know, if you have a muscle imbalance in your quads and your hamstrings, I know that, you know, you may be at risk for low back pain later. Maybe not necessarily an injury, but just maybe some aches and pains down the road if they're not already showing up.
And you may have a lot of low back pain now that you're contributing to a lot of other things, and simple stretching at home might really alleviate your pain. So sometimes, we can hit things where people are like, that's not even why I came.
Right. And so then we look at your stretch. So that's your range of motion. Again, looking for areas that might put you at risk if you have limited shoulder mobility or you've got tight hamstrings. I'm like, especially if you sit all day or you drive all day, we're going to give you some exercises to help alleviate what may end up being some low back pain down the road or just discomfort. Stability is your balance. We know that if we don't use it, we'll lose it. So a lot of times our balance will get worse over time and we don't even know it because we're not testing it. Yeah. We don't know it until we fall. And so we take a look at balance. There's some really easy ways to improve balance. And then last we look at stamina. So that's where we either do like a 6-minute walk test or a VO2 max. We love to look at the VO2 max because that is our best indicator of longevity. You can't fake it till you make it. Yeah. We can't give you a pill to make it better. It's just takes work to improve your VO2 max. So we want to take a look at your stamina because that's going to tell us, kind of how your heart and lungs are doing, and we can, address that if it's needed.
And a VO2 max is, we put you on a treadmill. So it is where you're wearing a mask.
You're going to walk or jog, and Holly's going to coach you and cheer you along and say, okay, let me know how far you can go. And then it's looking at your amount of oxygen, carbon dioxide through how you're breathing. It's looking at your heart rate. And so there's a lot of objective data to say, how does your muscle and your heart best utilize your oxygen for aerobic exercise? And by how you do that, it is a huge picture of how your heart and lungs are working. And when the heart and lungs wear out, then we are done. Yeah. And so there's a lot of ways to evaluate where you're at. Amber and I have both had the privilege of doing a 4S assessment. It was so eye-opening.
We got superior though.
We did get superior. We would like the record. We would like the record to reflect that. And I would like to say for the record also that I held my plank longer than Scotty. Yeah. And Scotty is super competitive. And but then Scotty was like, tell me how long I have to go to beat Dr. Plaster. And then I think she beat me. Yeah. But we had fun with it, but it was also really eye-opening because I know in the amount of geriatrics that I do that we lose our balance over time. It is a natural way of how our brain progressively, develops over time, that we lose our balance. And so in my early 50s, I can't have bad balance now. I'll have horrible balance in my 80s. I know that this is what happens if I'm not paying attention to it. And one of the things that I was worried about, how strong am I and how long am I going to be able to run on this treadmill? But my balance wasn't great. And so ever since, this was years ago that I did this assessment with Holly. And ever since, I stand on one foot when I brush my teeth, and then I switch feet, and then I just do all these little, daily balance exercises that take me no additional time or energy, but it's training my brain and my proprioception, and it's telling me how to make sure that my body stays in balance. And so I think that was eye-opening. Also, when I think the things that stood out to me, and then I'm going to have you talk about what you got out of your 4S assessment. When I did the VO2 max, and I'm usually a runner or walker. I like to do cardiovascular exercise. My deficit is probably lifting weights, which as I age, I need to lean into more, and I'm trying to do that. But I was in my VO2 max. I did well, and I was pleased with it. But I also kind of had this like eye-opening of, okay, what do I do to keep it where it is now? And you taught me a lot about zone 2 exercise, or where I'm supposed to be and what my heart rate should be when I'm doing things, so that I'm actually just going for a run is good, but being a little more methodical about it gives my heart and lungs better exercise. And so that was really eye-opening and kind of changed how much I pay attention to my watch and my heart rate and those kind of things when I'm exercising. And if you're going to do it anyway, why not do it right and get the most out of it?
Right.
What did you like about or learn in your...
So when we did ours, we also did a body comp, okay? And I learned that I had really tiny little arms. Like I felt like I was strong, but I feel like that was the part that I actually had a strong base, but not strong arms. And so that was the one thing I kind of took away.
And I think Holly does body compositions with people here.
Yeah.
And
so we were able to do both at the same time. So it was gave me more data than just
and
the
it's
for
so
us.
interesting when Holly does a body composition, there's so much great information she gives about the types of exercises you need to be doing and how you build your
she
strength.
was like, girl, you got to lift some more weights.
When I interpret people's body compositions, I'm like, do you have sleep apnea? Because this doesn't feel like the right amount of visceral fat. And then Holly's like, how are we going to build muscle? And so I think that's huge, and it's objective data. Like nobody's saying this is how your arms look. This is what your arms measure to be.
Yeah. And my right one was bigger than my left because I'm right-handed. So like that was, but anyway, she was telling me like to lift more weights. Essentially, I had little weakling arms, and I got superior on everything else, but my arms were weak.
and it's motivating. It's motivating when you get this kind of information.
It is so motivating. I think particularly the VO2 max and the body compositions, which I love doing body comp scans. I love going over those results with people. I don't think that you can come in for either one of those assessments and not leave motivated.
I agree.
Because I think some people may be a little scared. Like, I know I'm not where I want to be. I know I'm not where I should be. So I'm not going to look, you know? But I'm like, it is so motivating. Either you come in and you know, I'm not where I want to be. I need to get started. If you just need to get started, well, this is going to give you a baseline and a plan going forward.
Yeah.
If you think you are where you want to be, that's where I was, truthfully. I was like, I'm fit. I'm exercise.
Holly's the person who goes on vacation, walks. She only vacations places where she's walking 20,000 steps. And then in the evenings, like, who wants to go on a run? And so
that is true. I mean,
when we looked at your stuff, I thought it was really eye-opening.
Yes, it was very eye-opening. I realized that I was not, in fact, 28 years old the way I think I am. I still feel 28. I'm like, no, I'm in my 40s. I had been doing the same workout for years, and my muscle composition, my lean mass showed that. I was like, wait, how am I not like really fit? Like, I think I'm like a fit person. And so I was like, it was eye-opening to me, but I thought, don't you want to know?
Yeah.
Wouldn't I rather know that like what I think I'm doing I'm doing the right things. I'm like, wait, I actually have not gone up in weight in probably 15 years. I need to eat more protein, probably need to get my hormones checked.
Yeah, and you're working so hard.
Yes, think I'm at the gym.
Yeah.
But I was like, oh,
I remember us talking, and I was like, how much protein do you get in?
Yep.
Because you're doing stuff to build muscle, but if you don't have the building blocks for muscle, what do you think you're going to build with?
Right.
And you were able to take some simple changes.
Very simple.
And in doing that in your 40s, then we're not in our late 50s going, when did I lose all this muscle? But I've been exercising all along, which we know we sit with those patients.
Right.
And it's like, when did I get weak? Because I don't remember, like something happens where you have to pull yourself up out of a swimming pool one day. And you're like, when did I not be able to do this?
Well, and I think too, I don't know if I should tell people this, but when we look at that body composition scan, I told them, we can keep you alive. Y'all can keep people alive a long time down there in the medical clinic.
Oh, yeah.
We got plenty of pills
Yes.
to keep you alive, but it's how do you want to live?
You are 100%.
If you're letting that muscle mass just go down and down and down,
Yes.
you were going to get to your 70s and 80s and not have the strength to climb stairs. You're not going to be able to get out of a booth at a restaurant because you're too weak. You're not going to have the stamina to walk 4 football fields away to go watch your grandson play football. So I'm like, you can live. We can keep you alive.
Well,
but let's live well.
We do in the clinic during Medicare wellness visits is the grip strength. And you know, my grandmother is back in town, and you must see her.
I love her. She's my best friend.
She's hilarious. And so my grandmother's grip strength was weak on the left hand. So she scheduled an appointment with Holly. And Holly was like, you're much more weak on the left side. So she's been working on that. But my son has a graduation party coming up, and it's outside. And I was like, are you doing your stuff? Because this is outside and you're going to have to walk. And she's like, oh, I know. And I'm working on it.
Oh, and if that woman ever had to use a walker, she'd just
she would die.
She's too big for that.
Yes,
Yeah,
she always looks too
It would
cute.
be well decorated. But
She was a great example because she's 82.
Yes.
Right? She's 82?
She's 82.
Yeah. And so, but your kids are only in high school.
Yeah.
And I know they play basketball.
Well, that's her
basketball
great-grandchildren.
bleachers.
Yes.
Oh, yeah, because it's your grandmother.
It's my grandmother. So it's my kid's great grandmother.
I'm like, well, I see so many grandparents where everyone's holding their breath as they're climbing the bleachers because, you know, there's a couple of bleachers that don't have a rail and you got to make a step.
yeah.
And so she's like, I'm like, you got to be able to climb basketball bleachers. She was like, yes, I do.
Yes.
I mean, Reese is only a sophomore. I got 2 more years.
Yes. And this is the stuff that really, the simple stuff in life. And I love when I hear Holly talking to people and you talk about the importance of hip flexors and being able to do a squat. And sure, let's do squats. That sounds like exercise. However, no, what a squat is getting off a toilet. And so you want to go to a public restroom and get stuck on a toilet because this sounds like what? But this is the stuff that happens all the time. And then that's why people have these bathroom falls.
Or be able to hover.
Yes.
You're not going to have to sit on a public toilet.
More importantly than getting stuck on the toilet is having to touch the toilet itself.
You want to be able to hover over that toilet.
Absolutely. I mean, and these are being able to lift your leg. How many times do we see people where their whole face is bruised up because they tripped on the curb because they didn't realize that they don't lift their leg as high as they used to. And these are subtle things that sneak up on people. And it is typically found when insurance physical therapy gets involved after you have bid it on the curb outside of the Waffle House. But we can avoid that.
We can.
And you can. And in your 30s, you're building muscle. And in your 50s, you're losing muscle. After age 30, muscle is trending down. Gradual, slow trend down. Post-menopause for females, that took an accelerated course. And into your 60s, you are losing muscle rapidly. And so the time between 50 and 80 is a loss unless you're doing something about it. So all of this being said, you really have to know where you're starting. Every decade of life, you have to be working on your muscle and your musculoskeletal system because it is your independence. When that stops working for you, no matter what other organs may be excelling, that is how you live independently. That is how you get up and down bleachers or even across a house. That is why you end up in nursing homes more times than not. And so it's crucial to know these things. Holly also does a great job. She doesn't just tell you where you need to work. She gives you the information on what to work on. And then she sees you back so that you can, first, it's your accountability. You can come in. Holly has 2 exercise classes that she does. One of the reasons you can go to any gym and do exercise, and we don't desire to compete with those exercise classes at gyms. There's a reason why we have a physical therapist leading exercise classes, because when we're talking about people who haven't exercised in a long time, maybe because of morbid obesity, maybe because of age, or people who have had some health issues and they're afraid to exercise, Holly knows how to push them safely and get them to advance. But tell us some of your success stories about some of the people you've been working with.
So I think it was Thanksgiving a year ago. It was so much fun. One of the ladies came in and said, I was able to get the frozen turkey out of my freezer. She said, I haven't been able to lift a frozen turkey in like 5 years.
Yeah.
She was able to lean over the deep freezer and get the turkey
Not
out.
only did she not have to ask for help, could go ahead and start without the family arriving, but what a sense of accomplishment. And what else can she do? You know, that was immeasurable, but what else can she do?
Right.
You see one of my patients that is a huge success story. He's in his 60s, still working, really busy, intelligent guy. And he ended up with back-to-back pneumonias and then a heart attack. And this was the time when I said, and here's the beginning of a new life for him. He's going to retire. He's going to have to slow down. He's not going to be okay. He started embracing all things in our wellness center, including Holly. He has worked with Holly every single week. And one of our personal trainers that does body comps was like, I had this 70-year-old that I was putting on the scan. And I was like, I'm going to have to give this guy who's been working hard bad news because I know he has not gained muscle. Yeah. He had gained 8 pounds of muscle. He was stronger. He's thinner. I've taken him off of medicines. His cardiologist wants to know what he's doing. And what he's doing.
Holly. Yeah. Holly in his back pocket.
What he's doing is some organized physical therapy where he's getting regular exercise, and not because he's sick, but because he doesn't want to get sick.
Right. And he and his wife both come. They come to 2 different classes, but they both talk about how much better they feel when they come.
Yeah.
And so it's also funny because the hardest part is getting here, you know?
Absolutely.
The motivation.
Getting off the couch is my biggest barrier.
The hardest part is getting here, but I feel so much better when I come. And so that motivates them to come because they know, like, the rest of my day is going to go better. I'm going to feel better today and tomorrow.
Yeah.
Just if I get there.
Yeah. DEXA body comp scans are a great way to learn about yourself. VO2 max, you can do those things separately or all part of a 4S evaluation. The full 4S evaluation tells you everything you need to know about yourself and gets you custom exercise programs. But really, if you don't know where to start, meeting with a physical therapist and being able to engage and figure out where your strengths and deficits are is going to tell you how to actually build the right exercise program. If we're going to get off the couch, which is the hard part, and do something, let's make sure we're doing something that's going to benefit us,
right,
and doing it safely.
Mm-hmm. I would say probably one other benefit of working with me that I do differently than other physical therapists, and they may do this, but I've never seen this, is I'm going to talk with you through your schedule. What does your day look like? Yeah. And when can we put this in? Yeah. Because I know for me, I did end up having hip surgery, I don't know, maybe close to 10 years ago. And going to physical therapy, I would go and spend about an hour there. And then I had all these exercises that I was also supposed to do at home that took about an hour. And I was supposed to do them a couple times a day. But I had 3 young kids at the time. And I was like, what in the world? Who has time in their schedule for this? And I thought, all of the times that I have said, go home and do these exercises 3 times a day, I just thought they were going to put this in the routine. Changing your schedule is so hard. Changing your own daily routine. And so I sit and say, okay, what's going to fit? Like, what can we legitimately put in your schedule or in your daily routine that you're actually going to do? I could give you a laundry list of exercises, but it doesn't do any good if you're not going to do them. Yeah. So let's pick a reasonable number. Let's pick some things that are actually going to fit with you. So it might be every time you go to the bathroom, put this sticky note on your bathroom mirror. We're going to do these. Is there a certain TV show that you watch every day? During commercial breaks, I want you to do these exercises. Yeah. Okay. During commercials, what does your, food schedule look like? Do you cook? Do you warm up something for lunch? Okay, every time you use the microwave, I want you to do this exercise. I want you to be doing some balance exercises when you use the microwave, so that it starts becoming part of your routine, it's not just, you're not trying to find an hour to do exercises.
It's not in the calendar. Mm-hmm. It's just part of your
day.
And
that's why we love and trust you. And that's why I tell my patients to come see you. It's you're a trusted part of our medical team. And I want my patients to see you. And I'm like, of course you need to go see Holly. Like, even for, not even for older patients, but for my younger patients, perimenopausal women,
I'm like, athletes, our children are athletes, and they've met with Holly.
Yeah.
Movement matters. Movement matters. Medicine. And yes, movement is medicine. And if you are not taking that medicine, you need to figure out how to start, because the day that you can't move, you will regret it a lot. Yeah. So movement matters would be our message for today. We like to leave you on a good note. So here's today's Tell Me Something Good. Your future self benefits from today. The decisions you make today not only impact today, they greatly impact tomorrow. So think about that while you make the decisions to invest in your future today. Thank you for joining us, and until next time, take care of yourself.